Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
With the current looming terror threat, many of you will have to undergo security checks using X-ray, body or baggage scanners while accessing public spaces. Also, if you have undergone any kind of scan where radiation is used as a tool of diagnosis or treatment, then you may want to know that there is a team of people who make sure that X-ray machine, computer tomography, or the cancer machines give off the right amount of radiation for the desired purpose. And these are medical physicists.
The medical physicist is the champion of radiation safety. We also check always on the doses received by the patients.
They are so crucial to the health sector in that their absence could be detrimental as regards diagnosis and treatment using radiation. Medical physicists work more with radiographers or radiologists. Dr. Harriet Chisembo, a senior consultant radiologist and clinical head of diagnostics at Mwesigye Hospital, explains why.
There are some cancers which we call them radiation-induced. So instead of the radiation helping you to make a diagnosis, it may lead to cancer. For example, you give an underdose or you give an overdose, it can be detrimental to the patient.
According to Dr. Chisembo, the need to use radiation at Mwesigye Specialized National Referral Hospital is increasingly growing and was exacerbated by the COVID-19 pandemic.
I was looking at the CT scan, for example, just one unit we have in Mwesigye for the month of July and September. Worked on I think 900 patients, okay? And that's only one unit, but there are 2 CT scan units in Mwesigye. So that shows, and most of these are accident patients. We found CT scan to be more useful. You could find a patient, the test tells you negative, they do a PCR is negative, but when you do a CT scan, wow, you could find that the patient is very positive.
But all this load lies on the shoulders of 9 medical physicists who currently work at the Cancer Institute.
12 in number for a population of 45 million. That's about 1 per 5 million or more.
At least Ministry of Health this year has recruited 1 medical physics. As I was saying, in diagnostics, we need these people.
We need to train more medical physicists so that every regional referral hospital has at least a senior medical physicist.
It is also worth noting that the public system structure in the country does not recognize medical physicists.
Mwesigye, for example, hospital is a national referral hospital, but I would tell you that we don't have a medical physics in our system recruited.
And for this reason, the existing lot in the country is poorly resourced.
We don't have all the equipment for testing, especially the fact that you have many cities in the country. These are computer tomography equipment where quality control is required. What we see that even the procurement processes which are taking place in the country, medical physicists are not involved. That's why some of these equipments, which are basic to come with a package of, say, a CT or a mammography machine, they don't come with it because medical physicists are not involved in the procurement processes at the hospital and also at the ministry level.
For now, a senior member of staff earns 3.5 million shillings as salary, which is just a drop in the ocean compared to what other countries pay.
You look at what people get in South Africa and Botswana, they get triple the salary. And more so in the private in South Africa, Netcare pays about 12 million Uganda shillings per month.
The 12 members formed an association in 2019 where the Permanent Secretary of the Health Ministry, Dr. Diana Atwine, officiated. Part of the duties of the association is to train and encourage more people into the profession.
Because medical physics programs are not in the country, that is a challenge that everybody who wants to study goes outside the country. We have crafted a medical physics curriculum and submitted it to Makerere University. So we are waiting for the approvals. Our plan is to have about 5 medical physicists to start with. So those ones we can comfortably train.
From 2004, we have managed to raise the number from 3 to 15. It has not been easy. But what we usually do, we have actually inspired, gone to these universities. There's a girl in Bositema. We have now entered Kyambogo University, and in Kyambogo, I think we have got 3 now, people with us here, but under training. But we go and we inspire these students to do projects with us in 3rd year.
Walter Mwesigye, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities.